This is Dr. Remolina. I'm a practicing pulmonologist in the Linden area for over 30 years, and I want to talk to you about a new procedure that we are doing. It's called the EBUS, Endobronchial Ultrasound. An endobronchial ultrasound is done through a bronchoscope. The purpose of this is to be able to sample lymph nodes that are in the mediastinum. For instance, if a person is diagnosed to have a tumor in the lung, we can easily go with a bronchoscope and access the tumor in biopsy and make a diagnosis. But we're not going to know how extensive that tumor is. And in order to be able to stage that tumor by using a simple bronchoscope that has a tip at the very end called an ultrasound, we can go into the tracheobronchial tree, get close to the area where the lymph nodes are that we can see on the CAT-scan, and by getting as close as possible, we can visualize those lymph nodes with the ultrasound, and at the same time put a needle through it and aspirate and get cells to be able to make a diagnosis. So the importance of this procedure is not only to make a diagnosis of a carcinoma, but at the same time staging. Now, before we were able to do this, we have patients go through a bronchoscopy, biopsy the patient, and then send them to a thoracic surgeon who would do what is called a mediastinoscopy, or another surgical procedure, which entails surgery, opening up the upper portion of the chest on top of the clavicle and putting a scope to sample the lymph nodes. With this procedure, all that can be avoided. And in one sitting, we can make a diagnosis, and at the same time, we can stage the patient. So I think this EBUS is very important, and it's not offered many places, but we are doing these EBUS procedures now locally. If you have any questions about the EBUS, please call our office, and we'll be more than glad to inform you.